Assalamualaikum doctors. In this video I am discussing a communication recall, that is evidence based medicine. This is most commonly come with the medical students. So what is the, as usual we start with IRCAP. So what is the definition of evidence based medicine is that it is a practically medical based on evidence to improve the quality of care we are providing to patients. It is integration of the three circles. So practically medical based on of evidence based medicine, that is three steps, three circles. So what is the three circles of evidence based medicine? Clinical expertise, patient value, best research evidence. So clinical expertise, patient value, best research evidence, these are three. For example, what is the example I see? If I have a patient with Jehovah Witness and the available evidence said that the patient needs blood and clinical judgment says the same, is the evidence considered as evidence based medicine? No, as it does not go with the patient value. So this is an example. You understand, three circles need to go, that is patient expertise, patient value, clinical expertise, patient value, and the research, best research evidence. Another example, I want to give prophylaxis to patient with recurrent UTI. Best available evidence recommend nitrofurantoin, but the patient has G6PD. Clinical judgment says that he needs nitrofurantoin. Is this considered evidence-based medicine? No, as it does not go with the patient value. So we understand from two examples. Steps of evidence-based medicine. There are 5 steps of evidence-based medicine. Step 1, step 2, step 3, step 4 and step 5. Step 1, ask a clinical question. Step 2, acquire, that is the best evidence. Step 3, appraise the evidence. Apply the evidence. Step 4. Step 5, assess the performance. So 5A, first of all, ask questions. Number 1, ask question. Number 2, ask and then acquire. The best evidence we will acquire, then appraise. Acquire, appraise, then apply, then assess the performance. Apply the evidence, assess the performance. Ask a clinical questions, acquire the best evidence, appraise the evidence, apply the evidence, and then assess the performance. That is actually ask a clinical questions with PICO, PICO. So what is PICO? I am telling, for example, evidence-based medicine of use of nebulized saline in bronchiolitis. PICO we can maintain. P for patient problem. Patient problem is bronchiolitis. I for intervention is nebulized saline. C for compare, who takes the nebulized saline when, whom not taking it. And outcome is nebulized saline is good or bad for patients with bronchiolitis. So ask questions, first steps of our evidence-based medicine, that is PICO, patient problem, then the patient problem, and then intervention is nebulized saline, problem is bronchiolitis. C for comparing, that nebulized saline taking or not, and O for outcome, that is who are getting benefit or not. Number 2, acquire the evidence, like we got it from evidence-based medicine pyramid. Appraise the evidence, suitable or not, apply the evidence and assess the performance. There is a pyramid of evidence-based medicine. The pyramid are from, if we go from below to up, then first animal and laboratory studies. Second step is that case report or case series, narrative review, expert opinion and editorials. Number 3, case control study. 4 is cohort study, then randomized control trial, meta-analysis, then clinical practice guideline. There are lots of steps, evidence-based pyramid. Then we clinical practice the guideline. First we animal body study, then case report, case series, then case control study, cohort study, randomized control trial, meta-analysis. Then we go the including on the guideline. What is case control step? That is a retrospective looking for risk factors, for example smoking and lung cancer. I will bring a group of lung cancer patients and I will take history from them to see who was smoker and who are not. Cohort is prospective. Expert cohort is observed for outcome. It is theoretically speaking, as it is not ethical statistics. Randomized control trial is that it tests medication and I have 2 groups of patients. One give them placebo and one give them treatment, and I will document the response on both 2 groups. Systemic review is that collection of the studies done on certain topic. For example, all studies done on relation between the smoking and lung cancer collected together and present in an online database called coherence library. Meta-analysis is a statistical study conducted on collective studies. Okay. What is the best evidence? Best evidence depends on study and effectiveness of the treatment. Guess with me, if I have treatment with meta-analysis study in comparison to the randomized control study, what is the best evidence? Then meta-analysis excellent, benefit of evidence-based medicine. Benefit is it is easy way to get information fast, updated, measurable, and cooperation between the different doctors from different countries, improving the quality of service received to the patient. So benefit is very important. They can ask what is the benefit of evidence-based medicine. Easy way to get information fast, it is updated, measurable, and cooperation between the different doctors from different countries, improving the quality of service received to the patient. National and international guidelines and restrictions in evidence-based medicine. So like nothing is the best, but maybe national guidelines take into considerations our patient values, environmental conditions, and economic state issues. That is why may be suitable. So they're telling national and international. National is our control, our weather, environment, accordingly, and how the people believe everything. Why not all people following the guidelines? They may do not realize its importance and the medical legal aspects of nothing following it. So they don't understand the importance. Is expert opinion is out of respect. Every personal experience must go through different steps before considered to evidence-based medicine. If I need a rapid answer in a busy day, what can I do? May I need to check NICE guidelines or up to date? Both of them depend on the best evidence. What is cookie book? I do not know. What is coherence library? Online database collection of systemic review. So mainly we understand evidence-based medicine is that it is a three steps of to improve the quality of our service. So what is three? That is clinical expertise, then patient value, and the clinical expertise, patient value, and the research evidence, best research evidence. These are the three. Example like two example they give. First of all, give suppose a Jehovah need blood. Here three, it is not clinical based medicine, evidence based medicine follow, because why? Because here clinical expertise needed, here evidence research, best research present, but patient value is not working, patient not want. This is example evidence based medicine. And there is 5 steps of improvement. Number 1, assess the question. 5A, assess questions. Assess, then acquire. Okay, I'm telling. Assess questions, then acquire the best evidence. Yes, acquire the best evidence, appraise the best evidence, then apply the best evidence, and then assess the performance. So ask, acquire, appraise, apply, and assess. 5 steps. And how can ask question? That is PICO. You understand? PICO is P for first of all the problem. Problem is suppose bronchiolitis. Then interventions, that is nebulized saline. C for the comparison, who take the nebulized saline in bronchiolitis and who not, and outcome that they get the benefit or not. This is, and these are the another evidence-based medicine. There is a pyramid. Pyramid is a very big steps. First of all, we anything evidence-based medicine. First animal, we research animal. Then we case control. Then case we research, then case control study, cohort study, then randomized control trial, and then meta-analysis, then we include in the guideline. So evidence medicine, what is the benefit? By we improve the quality of the service by this research everything. And why people not follow the guideline, we will tell that they don't understand the importance of that and medical legal aspect. So this is evidence-based medicine communications. Thank you.